Well, hello and welcome to the Northwest Community College Healthcare Assistant Program. This is our first information video that we've tried to record and upload for you. So with us today, we have a number of our faculty. I'm going to turn the meeting over now to Dr. Stephanie Mullins. She heads up the program for us. And then Dr. Mullins, if you would, introduce your co-hosts here and start talking about the program. What do students need to know?
Okay, thank you so much, Dr. Jones, and appreciate your leadership at our Oxford campus. I am Stephanie Mullins. I'm the director of the HCA program at Northwest, and we have with us today Miss Carly Weeks, who is one of our great instructors in the HCA program. And HCA stands for Healthcare Assistant, and she is at our Oxford Low campus, and we have Miss Rita Kramer with us today. And she is our faculty member at the DeSoto campus. And then we have Miss Amanda Arman, and she is our great guru of student support services and help and administration, and you name it, she helps us with it. So I'm happy to have all of them on with us today. We are excited. We want to help answer any questions that maybe you may have about the healthcare assistant program, and also provide you information on how to contact us as well. And so with that, I will just give you a brief overview of the healthcare assistant program, and then I'm going to open it up to the faculty to share some more of the nuts and bolts of the program. But the healthcare assistant program is 1 semester. That is an awesome opportunity for you to earn your certificate in the as a healthcare assistant. This then provides you to be a sitter, a home sitter, help in home health, help in a nursing home, multiple avenues, doctor's offices to the hospitals. The opportunities are out there, jobs are available and much needed, especially in this time of crisis that our world is under. But the program is 1 semester. And I honestly would encourage anyone that's interested in any healthcare profession, EMS, surge tech, practical nursing, maybe you want to go into the medical field as a physician or what have you, and you want to learn the basics. You will come out of this program having your CPR certification, understanding the skills involved with taking care of patients, as well as vital signs. So with that, I'm going to turn it over to them, and they can speak more in depth about the program. And Miss Carly, why don't you start for us, Miss Weeks?
So my name is Miss Weeks. I'm the instructor at the Oxford campus, and I think Dr. Mullins really summed up the program wonderfully. Just elaborating on what she said, we have students that in past semesters have gone to work in mental health facilities. They have gone to work in drug rehab facilities. Anything that you can imagine. This is not just a program to go work in a long-term care facility. We see these students go on to the practical nursing program. We see these students go on to the registered nursing program here at Northwest, as well as cardiovascular tech, surge tech, and it gives you a wonderful opportunity to learn the base knowledge of what healthcare is before you enter a program that is so rigorous. So just like Dr. Mullins said, the basics that you learn in this program help you to excel in your further programs, or when you go to these doctor's offices, you are certified. So you have that certification under your belt that you can offer to the potential employers when you go to apply for these programs.
Thank you so much. And that's a great summary as well. Ms. Kramer, what would you like to add to that?
Y'all did a great job talking about our program. Before I became an instructor, going on 4 years, I did not know that the extent that this program taught you about the healthcare system. So we've seen people come from high school. We've had people that were in their late 40s, early 50s. We've had a student with 7 children, and people are working full time. And what it gives you is not only a sense of accomplishment for completing the program, but it gives you that knowledge, like Ms. Weeks and you were saying, Dr. Mullins, about getting your hands into the healthcare system. Some people come into our class not really knowing what it's about, but during our class, we have people come in like Dr. Mullins with the PN program, We have people come in for cardiovascular tech program just to kind of let us know what's out there. This could be a stepping stone, or this could be your career. Either way, in the healthcare field, it is something to be proud of, and it's admirable to be in the healthcare field. I'm proud to be an instructor. I just want to talk a little bit about the instructors. I have never seen a group of instructors that take such pride in their work. Their knowledge, they're prepared, and they're also caring, and they're also supportive of the students. So anything that's going on in your lives, if we can help you, we will. There are a lot of resources in our program, through our program in the college, that we want y'all to be aware of. I've had our counselors come and speak to our students about just the counseling program or financial aid. So there's a lot that this opens up for you in your lives, not just healthcare assistant. So I just want to encourage you to step out. I know it's a little bit not scary, but nerve-wracking to do something new. But if you've been sitting around thinking about it, I'd say just make the call. We'll give you emails, and contact us, and we'll talk to you. And we can also personally answer questions that you might have about our program. But we would love to have you. We welcome you to the college. We welcome you to our class. And we are very excited that we get to introduce ourselves and be a part of your lives.
Thank you so very much. And Ms. Armin, is there anything that you would like to add, your perspective or your connections with the HCA students and the program?
Absolutely. I'm part of admissions and records, and if you are interested in starting this program, I would love to talk to you and get you started. First and most important thing is to fill out an application for admissions, and you would just go to our website, northwestms.edu, click on apply online, and you're going to start an application. If you get stuck on that application, don't stop. Give me a call at 662-236-2023. I will be more than happy to assist you. We will need official high school transcripts. If you do not have an official high school transcript, we will need an official GED transcript. No worries if you don't have that. We can contact the Wynn Job Center with Miss Elise Sellers, who assists with that program, at 662-236-7201. So we're here for you, whatever you need.
Amanda, would you go over some of the questions that you get regularly from students? Because I know that some of the folks in the program have been out of school for a little while, and maybe they've got questions that are common to the program and common to the student body.
Okay. Yes. Actually, I get a lot of questions about attending previous colleges. Will they need those classes transferred to Northwest? Absolutely. So we will have to have an official high school official college transcript from those institutions, and they'll send those electronically to us. And some people just have questions of, am I too late to start this program? There's never a too late. We're always here to help you.
I would like to add that we value this healthcare assistant program so much that we encourage our students to attend the HCA program and therefore provide points that help their PN application and getting into the program because it is so valuable. So that is one reason why we're invested in it, and we really want it for our students.
And this would be for Ms. Weeks or Ms. Kramer. So what sort of, how does the program laid out? Students come in day one. Are they sitting in the classroom for 10 hours? Are they out in the field? You know, what is actually the structure of this type of a program and the learning that goes on, both at the beginning of the program and then as it develops? So I'll let either one of you answer that.
Ms. Kramer, I can start with my campus, and all of our campuses mirror each other. So every instructor is in constant communication of, what their campus is doing and what lessons their own, so we all stay in constant communication. So all of the campuses mirror each other. But for Oxford specifically, it is a Monday through Thursday course, approximately 8 a.m. to 3:30 p.m. It is a very rigorous course. Every day we're in the classroom for at least 8 hours a day. And as we get through the first core chapters, we start going into the labs. We start doing our hands-on skills. In those skills, you are going to learn everything from feeding a client, bathing a client, dressing a client, all the way up to your basic vital signs. So we learn how to count respirations, how to count heart rate, manual blood pressures, which this day and age is, kind of a thing of the past, but we still teach that, and that is the core vital sign that we have to know as a healthcare provider. So then after we master the 26 skills that we have, we go into the clinical setting. And in my program in Oxford, we go into all different types of clinical settings. We go into a home for the mentally disabled. We go into a drug rehabilitation home. We go to long-term healthcare facilities. We go to the Baptist hospital that's across the street. So we have lots of learning opportunities and lots of different places to show you what you can do with this certificate. And I also want to remind the students that as a healthcare associate, you are the one that spends the absolute most time with the patient. 100%. I tell my students this all the time. You know the patient the best. You see the patient the most. You are the one that gets to know their mood and their personality. So you are the core of the healthcare system. Ms. Kramer, do you have anything else to add?
No, you summed it up very, very well. And I like it because we all work together. So the students, like you were talking about, we have the skills part of our lab. You come in and the first week we go through like an orientation over the whole course. We answer any questions. We refer you to people if you have a problem. We have a textbook with 24 chapters that we go through methodically. We have skills, like Miss Weeks was saying, we have 22 skills, and we just methodically, we have it planned out. You get a calendar. This is what we're doing this day. This is what we're doing this day. So no one has to wonder, what are we doing? It's very organized and very laid out. We just have very open communication, and it's very organized, which I like. I'm trying to think. We teach you CPR. We help you get a resume together. We have times when you go out into the field, you get to see how everyone else works. It's very interesting. Like Ms. Weeks was saying, we also go to the mental health facility, developmentally disabled, home health, the hospital, and they give us tours. So you know where you could possibly work and use your skills. It's not like Ms. Weeks said, just in the long-term healthcare facility. Although we have students who absolutely love the long-term healthcare facility and that patient population. They're very dear to our hearts, and that is what our focus in this program is that generation with your moms and your dads and your grandparents. So we get a wide range of opportunities to go out into the community and even sometimes to serve the community. So it's just a very well-rounded, very organized program, but it consists of the workbook, the hands-on, and then going out into the community to show you what's out there.
So I have two questions for those of you here on the call. I know I was in a meeting a month or two ago with Dr. Mullins and some other healthcare professionals here in the Oxford area at a particular facility. And the administrator talked about the special need in healthcare for someone who wants to be with the patients, someone who wants to provide care and wants to spend their time actually hands-on with folks, because there are so many moving parts in healthcare these days. And so would you talk a little bit about that and what the successful student brings to the table when they come into the program?
Ms. Weeks, do you want to speak first? I don't mind.
Go ahead.
I see the healthcare assistant or the nursing assistant in the healthcare setting as the base, as the pivotal part. They're the ones that get to know that person very, very well. They can walk in and say, it's Miss Jones, just say there's a patient, and they know Miss Jones is not acting right today, because they know that person very well. And we give holistic care, which is not just the physical care that we're talking about, not just our skills like bathing them, but their mental, their emotional health. You get to know their families, and we're the ones that will be able to speak up and be that patient advocate. So it's a very, very important role, very important in our program, that they can speak up for that patient, because we all need advocates in our lives. We all need someone to say, Miss Jones is not feeling well. We tell the nurse, who will speak to the doctor, who will possibly come in or send them to the hospital. So I see the healthcare assistant as the one who knows that patient the best, just like Ms. Weeks was saying. So we have almost the most important part to speak up for that patient, to recognize when things aren't normal, to see maybe the blood pressure is high or low, to see the color of the patient, just if they're pale, if they've got blue tinged around their mouth, if their pulse is erratic, if they're having chest pain, because we see that patient every day. We are intimately involved in their lives. And I think it's just an honor to be a healthcare assistant, to have that kind of knowledge of that person that we can share with other healthcare providers to take care of them.
Ms. Weeks, anything to add to that? What does the successful student look like that comes into this program?
So just piggybacking on what Dr. Mullins has said and Ms. Kramer has said, the student will come out of this program with a resume in hand, a professionally done resume. We have a resume workshop, so we are gearing you towards the workforce. They will also come out with a CPR certification, and that CPR certification is good for 2 years. Also, they have a great base knowledge of the medical field and what the different medical personnel look like inside of a long-term care facility or hospital setting. And they also have a set of skills that are taught to them over the semester that they can go into the facility and confidently know that they can take care of a patient fully, very well. My students last semester, if they were not accepted into the PN program, they are all currently working and they had no problems getting a job whatsoever. I have someone calling me at least twice a week looking for good healthcare assistants. And the reason that they call me is because Northwest has a reputation for putting out students that have a great base knowledge, that know how to take their vital signs, that they know when they come into these facilities that they don't have to teach them so much, and they can go on and get on the floor and start working and helping these patients. So I think, and another thing that I want to encourage students, if this is what you're looking for, I have so many students that say to me, Ms. Weeks, this is nothing like any other college class I've ever taken. They're so used to going to a college class twice a week for 45 minutes a day and not really getting to know their instructor. Whereas with us, we see you for 8 hours a day for 16 weeks. We get to know our students very well. So when they're struggling, we learn that, we realize that when they are not being able to fully understand, we get to know our students well enough that we can pull them to the side and say, hey, I can tell you're struggling with this. What can I do to help? So just know that this is a totally different type of college experience that you've ever gotten before if you've been taking normal academic classes.
So I'll throw this out there for any of you. I hear this from time to time as new students are coming in. This is a college, but it is a different program. It's not like taking college algebra where you show up 2 or 3 days a week and you sit in the classroom and then you go do homework. And I've heard from some students, well, I wasn't the greatest student ever when I was in high school, or back when I was in college before, I didn't really enjoy it. What's different about a program like this versus what someone's expectation or experience might have been in a regular classroom? You've touched on it a little bit. Would you go a little bit deeper into that?
Sure. The difference is, like I said, we don't meet just 2 or 3 times a week. It's I don't just give you a handout and send you home with it and tell you to bring it back Wednesday. This is something that I am in constant contact with my students about. Most of my students either email me or have my personal cell phone number and they text me, and I am here to help them along. I've always told them I am not the person that's trying to pull you down. I want to see you excel. I want to see you get confident in yourself. I want to see you learn to love this career path as much as I do. So we do all different types of learning activities. We have Cahoots. I know a lot of the high school students now are familiar with Cahoots, so we play Cahoots. We do different type of learning strategies. Some people are better in the lab and excel in the lab, whether it is working on the mannequins or working with their partners. And some people do really well in the classroom settings. We have PowerPoints. I lecture every day in person, so it's not just something that you're going home and you're having to learn how to do this yourself. This is something that the instructors, Miss Slocum, Miss Kramer, we are all kind of holding you along your back and pushing you along the way, although you never feel by yourself. Miss Kramer, is there anything differently that you do in DeSoto?
Exactly what you're saying. The class here, because of the nature of our course, which is our classes Monday through Friday, 8 to 3, because of the nature, we are more involved in your lives, but we don't intrude. We're just there to help you. But what I want I say children, that's my students to take away is that sense of empathy that you don't get. We're trying to show you how to be a compassionate caretaker, because beyond the skills, beyond the A, B, C, D of how you do a skill is how you treat a person. So we have to, in our skills, we learn how to make eye contact, talk to the patient one-on-one, let them know you care. So I think that part of our program teaches you how to be more empathetic and more involved in other people's lives, to be more, you notice things about them. We show you how to study, because the way our program is laid out, a lot of the students that come in don't have good study habits, which I'm very big on giving an assignment, explaining the assignment, walking you through the assignment, and then we review the assignment to make sure you have the right answers, and we discuss anything you don't understand. So one of the students in my class, one of the things that the comment she made was, I've never had anyone explain this to me. It's usually throw it out there, and nothing against anyone else, but you throw it out there, do the work, turn it in, we're having a test. We actually walk through the subject matter and we make sure that you understand, so that you can use this the rest of your life. If you're talking about congestive heart failure, these are the signs and symptoms. We share our own experiences in the hospital setting. I know with Miss Weeks and Miss Slocum, we've had a lot of experience in ICU and nursing home and doctor's office and home health and hospice. So those experiences, we can give you examples of, this is what I saw, this is what you're going to see. And one of our students, even with the CPR, our CPR class takes all day. It's not a 1.5 hour, it's from 8 to 3. And it's the whole time we're explaining, we're showing. One of my students, for example, I want them to learn the material. I just want them to understand. She came back a week later after we had gone through CPR class and said, Miss Kramer, I saved a child's life. And I said, what happened? She said, I was at work and a mom came in and their child was choking. She said, I went up and I took the child, did the Heimlich. With a child or an infant, you turn them up, down, and you hit back blows. She said, and I got it back up and I was doing chest thrusts. She said, and the child vomited on me. She said, I was so happy because he was breathing. And so that personal life experience, oh my gosh, it warms my heart, because I thought, oh my gosh, thank you, Lord. This child learned CPR. It's not just a card. They knew what they were doing. And so our goal is to help you with diseases, with hand hygiene, with the germs like we're dealing with now in our world, that my students, I know all of our students know how to wash their hands. We do colors, paint colors, And I'll line all my students up and I'll say, okay, you've got the flu, and I'll put a sign on them. And I'll say, okay, you've got botulism, and they all have signs. And then I put paint on their hands, and I stole this. This is not my idea. And then the other person will have a pencil, and they'll have red paint on their hands, and the botulism girl will get that red paint on that pencil and then say, oh, do you want to borrow my pencil, to someone in the community? And they see how germs are spread, that direct contact, that indirect contact. So the concepts we teach, we act out, or we show them realistically how you can use this, not just in your community, but in your facility. So the things that we teach in our class, they will stay with them the rest of their lives. And that's what I like about our program, that we have the time to not just teach, but to make sure that they understand it. And I think that's what sets our program apart.
Yeah, sitting here in this COVID-19 quarantine that we've all been under for about a month, it seems like about a year. I wish everybody had been through this program. We wouldn't be in this mess.
I completely agree.
So as we get ready to wind this down, I'm going to talk a little bit in general about financial aid. I'm going to ask Mrs. Arman to talk a little bit about tuition, and then we'll come back around and let each of you, anything maybe that we've missed, anything that if you were a potential student you might want to know, or anything you as instructors would want to put out there as we end this. So yes, this program does qualify for federal, state, and local financial aid. There is a lot of financial aid available to folks going into a program like this at a community college. That's the mission of the community college. And Northwest takes our mission very seriously. We want to see community success and personal success and student success. And so we are here to help serve you. We have financial aid personnel that are professionals in their field. After you get your application packet in, they can walk you through how to do that. Mrs. Arman, do you want to talk a little bit more about that as far as tuition and all of those things? Oh, hold on. Let's get you unmuted.
Okay.
Okay, there we go.
I do want to say that we have a financial aid advisor. His name is Mr. Stephen Bennett, and his number is 662-238-7944. But I will tell you that under our website, northwestms.edu, we have a tuition link that gives us full access to the knowledge of how much our programs are, how much per credit hour it runs. It's $140 per credit hour. If my understanding, the HCA program is around 16 credit hours. So we're looking at around $1,600 just for the classes. That does not include books or additional fees. But if you look at our prices versus other colleges, you will see that we are the best.
Yep. And just for some perspective on that, the college I came from was $1,000 a credit hour. And
wow.
So the wonderful thing about the community colleges is because we are part of the community, because there is federal, state, and local funding, we're able to keep those costs down to the rock bottom to the student. And even at that level, there's financial aid available to a great many of our students. So we don't see much sticker shock when it comes to a program like this. It is doable, it's affordable. The students are supported by the faculty, as we've seen right here, and by the staff and administration. We want to see you succeed. So with that said, Mrs. Arman, anything else that a potential student might want to need to know from your side?
Just to contact me at northwestms.edu, and my name is Amanda Arman. My direct number is 236-2023. And I'll be more than happy to assist you. Any question at all. Nothing is out of the box.
Very good. And Mrs. Kramer, any last statements, thoughts that you want to share?
I'd just like to remind everyone that we have 3 different campuses with programs. There's the DeSoto campus in South Haven. Then we have the Sanatobia campus in Sanatobia. Then we have the Oxford campus in Oxford, Mississippi. So just to remind you that there are 3 campuses that you can choose from. They're all the same program. And the other thing, the first thing I would just suggest is to get online at Northwest Mississippi Community College website and fill out an electronic application for our program. And that's your first step. That way we have all your information. and we can begin to send you the packets that you need to get into our program. And just to, you know, encourage you, we don't have like an ACT requirement. It's
Good.
just, so that's very important. So you don't have
Yes.
to worry about that. By the time you finish, we have ACT programs at the college that you can take. There's ACT workshops, which we will help you, you know, learn about where that is and when that is and help you get signed up. And the other thing is, after you give us your information online, then we print that out and we all have that information and we can help you. The packet is like getting a physical, TB skin test, different things that you'll need. That's mainly what you need to get into our program. So just to, you know, kind of settle your minds on that, not having the ACT.
Very good.
Our program.
Excellent. Mrs. Weeks, any parting comments, any last thoughts for our students?
I think the only thing that I want to remind the students that if you have any interest in the healthcare, facilities at all, please just, I encourage you to apply for the program, especially the students who applied for the PN program. Maybe this is not your semester to get accepted into the PN program. We know there's a lot of applicants, but go ahead and apply to the HCA program as well, because like Dr. Mullins said, you do get extra points when you go to apply again, and you will also get that base knowledge of what you need to know going into the PN program. So, you know, you don't have to sit out at another semester, don't have to sit idle. You can come in the fall semester, take the HCA program, and then again apply for the spring semester of the PN, and then you have under your belt those extra points that will allow you a better opportunity into the PN program next semester. Excellent. I am also available via email. My email is cweeks, WEEKS, @northwestms.edu. And please email me for any questions you may have, anything at all. And if I can't answer it, I will definitely get you to the person that can.
And Dr. Mullins, I think we'll let you close us out. Any parting thoughts? And I'm trying to unmute you and I'm not having any luck. So would you unmute yourself, please? There we go.
Thank you so very much. And I just want to thank you all for paying attention to us and listening to us today. I want to encourage you, especially in this time that we all are facing. Each of us are having different struggles and different concerns that are facing us. And I know essential workers has been a kind of a word we've said many times this throughout these last couple of weeks and months. And it is nice to know that you are essential in this profession. And a healthcare assistant is essential not only for our patients, but for our medical community, for health promotion, and to know that you could impact people and your community and those that are sick and hurting is such a rewarding feeling and a sense of purpose. And at Northwest here, we want to help you have that. And we will walk alongside you. We will help you in any way we can. I too am available via email at smullins, SMULLINS @northwestms.edu, and encourage you to attend. Thank you.
Very good. Everyone, thank you so much. We look forward to seeing you on campus in the fall. Go Rangers.